time. Nadhim Zahawi.
I'm grateful, Mr. Speaker, and with your permission, I'd like to make a statement on our vaccination programme against Covid-19. We know that vaccinations are our best defence against this virus. Our jabs have already prevented over 112,000 deaths, more than 143,000 hospitalisations, and over 24 million infections. They have built a vast wall of defence for the British people. Earlier this year, Mr. Speaker, our medicines regulator, the MHRA, approved the Covid-19 vaccines supplied by Pfizer and Moderna for 12 to 17-year-olds. They confirmed that both vaccines are safe and effective for this age group. Following this decision, the JCVI, the Joint Committee on Vaccination and Immunisation, recommended vaccination for all 16 and 17-year-olds and for 12 to 15-year-olds with serious underlying health conditions. They next looked at whether we should extend our offer of vaccination to all 12 to 15-year-olds, which would have brought us into line with what is already happening in countries like France, Spain, Italy, Israel, and the United States of America. They concluded that there are health benefits of vaccinating this cohort, although they are finely balanced. But it was never within the JCVI's remit to consider the wider impacts of vaccination, such as the benefits for children in education or the mental health benefits that comes with knowing that you are protected from this deadly virus. So the JCVI advised that the government may wish to seek further views on those wider impacts from the United Kingdom's chief medical officers, and the Secretary of State, together with the health ministers from the other devolved nations, accepted that advice. Our CMOs consulted with clinical experts and public health professionals from across the United Kingdom, such as the Royal College of Paediatrics and Child Health. They have also benefited by having data from the United States of America, Canada and Israel, where vaccines have already been offered to children aged 12 to 15 years old. Early this morning, we received advice from the chief medical officers, along with our counterparts in Scotland, Wales and Northern Ireland. We have made the advice publicly available and deposited it in the library of the House of Commons at 2 p.m. this afternoon, Mr. Speaker. The unanimous recommendation of the United Kingdom's chief medical officers is to make a universal offer of one dose of the Pfizer vaccine to the 12 to 15-year-old age group, with further JCVI guidance needed before any decision on a second dose. They have been clear, Mr. Speaker, they are making this recommendation on the basis of the benefits to children alone and not the benefits to adults or wider society. Mr. Speaker, I can confirm the government has accepted this recommendation. We will now move with the same sense of urgency we've had at every point in our vaccination programme. Mr. Speaker, as the chief medical officers reminded us today, whatever decision teenagers and parents take, they must be supported and not stigmatised in any way. We must continue to respect individual choice. As a father, the decisions I take on behalf of my own children give me extra pause for thought. People who wouldn't think twice about getting the jab for themselves will naturally have more questions when it comes to vaccinating their children, and I completely understand that. But to those who remain undecided, I want to say this. The MHRA is the best medical regulator in the world, and they have rigorously reviewed the safety of our vaccines. They have concluded they are safe for 12 to 15-year-olds. And across all age groups, we continue to have a comprehensive safety surveillance strategy in place to monitor the safety of all of the Covid-19 vaccines approved for use in the United Kingdom. And it's important to remember that our teenagers have shown great public spirit at every point in this pandemic. They've stuck to the rules so that lives could be saved and people kept safe. And they've been some of the most enthusiastic proponents of vaccine. This is at least in part because they've experienced the damage that comes with outbreaks of Covid-19. And we've seen more than half of 16 and 17-year-olds across the United Kingdom get the jab since becoming eligible just last month. Mr. Speaker, at every point in our vaccination programme, we've been guided by the best clinical advice. The advice we've received from the 4 chief medical officers today sets out their view that 12 to 15-year-olds will benefit from vaccination against Covid-19. We will follow that advice and continue on that vital path that is making more and more people in this country safe, and I commend this statement to the House.